Dr. Hilary's here now with this morning's health headlines, and it's everywhere in the papers today, the sentencing of former breast surgeon Ian Paterson. I mean, I can't get my head around this story. I really can't.
This will worry so many people. Can I trust the surgeon who's doing my surgery today? I mean, he got 15 years at the Nottinghamshire Crown Court for 10 counts, well, 17 counts of harming with intent, wounding with intent, and 3 counts of unlawful wounding. But there were hundreds of other women who may have been affected, and the NHS bill for compensation alone was something like approaching 10 million. Then there were private patients as well who don't have access currently to that compensation unless there's a civil action. So they're left, they've been wounded, they've had parts of their bodies removed unnecessarily.
A lot of upset.
Absolutely. I mean, he preyed on their fears, he exaggerated the risk of cancer or invented a risk of cancer that simply wasn't there. Only one man, I think, was cited in the courts, which is strange. However, it does raise all sorts of questions. How do you trust your surgeon? Well,
this is exactly it. How do you trust them? Do you need a second opinion? What does it mean? Well,
usually, I mean, within the NHS, colleagues work together, so they share their work, they share their researches, their pathology. They talk to the anaesthetist, and if there is something suspicious going on, a colleague would raise the alarm.
Yeah.
In this case, this is a surgeon working a large part of the time very alone, very isolated. And that shouldn't happen because we have an annual appraisal and revalidation system that every doctor has to undergo, which should weed out these rogue doctors. There aren't many. I mean, Shipman was one, here's another. He's got his just desserts. 15 years will certainly not be enough for many of his victims.
Yeah, absolutely that.
But I think if anyone has suspicions, I mean, ask the GP what he thinks of this surgeon, ask the surgeon's colleagues what they think of this surgeon, and make sure that you're happy and that you trust this doctor.
Well, one of his victims, actually, Carol, spoke to us. This is what she had to say.
I think 15 years is I'm quite happy with 15 years. I was expecting 16 to 18, but 15, that's fair enough. I feel that there's a lot more questions that I want answered. It should never have gone on as long as it did.
Absolutely, you know, Ian Paterson has a lot to answer for.
He does. Carol's quite right. There are questions that need answering. In particular, I think, why didn't this get sorted out through appraisal and revalidation? And why didn't the private healthcare provider under which he works and his insurance company admit some liability themselves?
Absolutely.